patient has come suspecting that he has a lump in his breast. So this is the procedure how we do the examination of the patient. First you have to do inspection. First you do the inspection. You have to check where the lump is, where he has suspected for the lump, and then you have to check the surrounding skin, whether it's red or there is inflamed or swelling, thing like that, redness. Then second step is doing the palpation. There are 4 positions where you can inspect for the breast examination. First position is he is relaxing and his hands are together with the thigh. And the second position, his hands should be on top of the head. You can see the lump moving when he is in this position. And third position is bending. You have to relax and then bend. This thing is moving, the lump is moving. Then the fourth position is you have to contract the muscles and then you can see the lump in that place. Okay, this is the way you have to do palpation of the breast exams. You have to first check for the quadrants. You have to draw quadrants like this: the upper out, upper in, lower out. And then for the angle of where it is, you have to draw quadrants like in the clockwise: 12, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. For the breast examination, the patient should rest his hands on the doctor's shoulder, and then you have to start palpating in this way, from periphery to the center to till the nipple. You have to do it for all the quadrants. After palpation, you have to tell the characteristics of how the lump was. First, when we palpated the lump, there was presence of lump in the upper in quadrant in 1 o'clock position, and it was 3 centimeters away from the nipple, and the surface of the lump was regular. It was not immovable. The consistency was firm and the size was around 2 centimeters, and temperature above the skin was normal, and skin color over the lump was also normal. There was no pain. The shape of the lump was oval shape, and there was just single lump present, and there was a protrusion like a swelling. Then you can do also auscultation to find any bruits or noises present in the lump area. Then you can do fluctuation test by keeping one hand like this and doing the other hand like this, so you can see the fluid movement if there is presence of any fluid inside the lump. Okay. So I have examined a lump in the left breast in the upper in quadrant in 1 o'clock position. Diagnosis is the tumor is in the right breast. We have to do further investigation, laboratory and instrumental investigations. The instrumental investigation can be ultrasound of the right breast, mammography, MRI, CT. Through this you can find how exactly where the lump is and the borders of the lump to find the diagnosis. And laboratories, you can do a complete blood count and to find tumor markers. Then you can go for biopsy. Biopsy should be done in 4 methods. Can be done in 4 methods. Biopsy can be done in 4 methods. One is needle aspiration. This is the way you have to do it. The first method is aspiration biopsy. You have to, this is the tumor. You have to apply inside the tumor, and then you have to aspirate. So the sample you have got, you have to send it to the cytological department. To find the tumor, presence of tumor or not. The second method is needle biopsy. The anesthetic is needed for this, and you have to do it this way. You have to press, and then you have to do like this for the tissue removal, and then take it off. And then this should be sent to the cytological department. The tissue sample should be sent to the cytological department to check whether there is a tumor or not. Method of biopsy, which is called the incision biopsy. You have to do incision with the scalpel, and then you have to open and take a tissue sample. Have to do incision, and then you have to like this. Sample you have to send to the cytological department. Overall, after seeing the characteristics and the laboratory test and instrumental test, we come to a conclusion that that the patient is having low-grade adenocarcinoma. That's the diagnosis. So, after investigating the TNM classification, we have to do other instrumental examinations like chest X-ray, liver ultrasound, brain MRI to see whether there is any metastasis of tumor.
No soft.
After TNM classification, we have to do further instrumental investigations like chest X-ray to find whether there is lung metastasis, liver ultrasound to find liver metastasis, brain MRI to find brain metastasis. This is the TNM classification we found. T is first stage, M is in the first stage, M is in the first stage. T first stage, it means that the tumor is in the mucosa, it's limited to the mucosa. N is first stage, means there is lymph node enlargements are 3 centimeters in diameter, and M1 means there is presence of metastasis. Next step is the treatment. First, we have to think about what treatment you should do. You can do chemotherapy, immunotherapy, because that's more useful for this type of tumor, because as metastasis is present, you can't do surgery, because if you have going to do surgery, it's not going to be useful, as you have to remove all the tumors from all the places. Then radiation therapy is also useless, because you can't do radiation in the brain. It can even kill the person. So chemotherapy, immunotherapy should be given. Chemotherapy can be given like once a month, continuously for months. Like you can't cure the cancer. You can just relieve the symptoms, patient symptoms. This is the examination of the thyroid gland to find any lumps or any tumors present. So you have to first tell the patient to move, and then you have to see whether they are symmetrical or not. Is there any swelling from the sides of the neck? Then after that, you have to do palpation of the thyroid gland. Palpation is done this way. The thyroid gland is palpable. The consistency is smooth. It's immovable. There is no any lumps present.